Ousted top vaccine expert Dr. Rick Bright warning the worst of the coronavirus pandemic may be yet to come if there isn't better planning and coordination. In his testimony before the House today, Bright said a lack of preparedness and scientific guidance from the Trump administration came at a human cost.
I believe by not telling America the truth or being fully transparent, regardless of where the information was coming from, people were not as prepared as they could have been and should have been. We did not forewarn people. We did not train people. We did not educate them on social distancing and wearing a mask as we should have in January and February. All of those forewarnings and all those educational opportunities for the American public could have had an impact on further slowing this outbreak.
NBC News correspondent Leanne Caldwell joins me now. And Leanne, what other frustrations, concerns did Dr. Bright voice today?
Dr. Bright has said that there were many missteps by the administration, by the Department of Health and Human Services, especially in these early stages of this pandemic, Allison. He points to medical supplies and the supply chain there, said that they did not heed warnings that there's going to be a need of a back supply of swabs, for example. On this issue of masks, this was a really poignant moment in this hearing. He said that he had a meeting with HHS officials on February 7th, saying that there's going to be a supply problem with these N95 masks. What the response was, he said, was indifference. They were skeptical that there was going to be a supply problem. And they said that if there was, then they would just change the CDC guidelines to ensure that it's the healthcare workers, the frontline workers who had access to this mask. And now, if you remember back in those weeks, Allison, there was a lot of mixed guidance from the administration on whether normal people like us should be out in public wearing masks. And they said no at the time, that it wasn't necessary, that it wasn't proven effective. Well, what Dr. Bright painted a picture of is they didn't think that there was going to be a supply problem, so they didn't prepare for it.
Leanne, Dr. Bright was also asked about the availability of testing in the U.S. Here's that exchange.
There was a visit to the CDC on March 6th, and at that visit, the administration said anybody who wants a test will get a test. Was that true then?
There still are not enough tests.
So even this week, as we're being told, anybody who wants a test can have a test. Is that true in the United States of America?
No.
Leanne, where else did Bright disagree with the president and the administration?
On the issue of the vaccines, that is a big thing that he brought up. What Dr. Bright said is that the optimism surrounding that's coming from the administration and the president specifically about a vaccine, the president is saying that they could have one by the end of the year. Another line is that within 12 to 18 months is what you hear from other administration officials. But Dr. Bright said that is an extremely optimistic timeline. He said that vaccines usually take 10 years and that it's very unlikely that it's going to happen that quickly. But he also had another warning as far as vaccines are concerned as well. He said that what the administration needs to be doing right now is to create the plan to distribute these vaccines. And he said that is not happening because they are going to have a huge task of trying to get people vaccines quickly once it's available. And that's the work that they need to be doing right now that he says is not happening.
Leanne, how did lawmakers react to Bright's testimony today?
Well, Republicans, they continued to, let's step back for a sec. The Republicans, they very rarely want to disagree with the president, especially publicly. The president put out a tweet this morning saying that Dr. Bright is just a disgruntled employee, that he wasn't very good at his job anyway. And so Republicans tended to continue along that frame, that line of thinking, saying that asking why hasn't he been to work since he has been demoted. They've also really honed in on this issue of the two malaria drugs, the hydroxychloroquine, that the administration was really pushing early on in this virus. You know, Dr. Bright says that's a reason he was demoted, because he was not pushing those drugs aggressively enough. He had questions about it and didn't think that they were scientifically proven enough in order to move those drugs forward. But, you know, Democrats, on the other hand, they had a lot of questions about those drugs too. They wanted to know if why the administration was pushing these drugs so heavily. So it was a very bipartisan response for the most part on Capitol Hill today. And Dr. Bright, while Democrats really championed the testimony of Dr. Bright as an example of the malfeasance of this administration in this pandemic response.
Leanne, the House panel also heard from Mike Bowen, an executive of a company that manufactures masks. How did Bowen back Bright's testimony?
He's a CEO of a mask company, and he said that he wanted to produce more masks. He said that he was willing to produce up to 7 million masks a month, and he could never get the administration to agree to a contract. And so, you know, he's not doing it. So he said that he backed up Dr. Bright's testimony, especially on this issue of masks, saying that the administration was not handling or, taking into consideration the need of the things that were going to be necessary in this supply chain, including these masks. He said that he is a lifelong Republican and that Dr. Bright was excellent at his job and that he's been treated poorly, and that he believes what he's been saying about, you know, raising alarm bells about this administration.
All right, quite a day on Capitol Hill today. Leanne, thanks for walking us through it.
Thank you.
The CDC released its guidelines for lifting stay-at-home orders today, weeks after the White House shelved some of the recommendations for being too restrictive. Dr. AMESH, ADALJA, senior scholar at the Johns Hopkins Center for Health Security, joins me now. And Dr. ADALJA, let's focus on the guidelines for reopening schools first. It says that daycares and schools should try to meet more than a dozen recommendations before they can open. One of those recommendations is to screen kids and employees daily. It says employees would need to wear masks, but didn't specify if students would have to. What's your assessment here?
I do think that as schools open, they have to have a procedure in place where they can identify individuals that may be harboring the virus and exclude them from school until they're better. And I think that that's what we're seeing everywhere we see openings. So, for example, when I go to the hospital, they ask me questions. Have I been exposed to somebody without personal protective equipment? Do I have a fever, a cough, muscle aches, or pains? That's what they're going to need to do to make schools a safer place. And I think it's something that's doable, and more businesses are going to have to do this in addition to schools, just as we go forward in this era of the pandemic.
The guidance for workplaces is similar. It also mentions more cleaning, disinfection, and ventilation. Could you remind our viewers why that ventilation part is so important?
Well, you want to make sure that the virus is not spreading through the ventilation, and that doesn't really happen that often. It's usually a very controlled setting when that does happen. So you want to make sure that there is adequate ventilation, that you've got plans in place to understand how your air conditioners work, how your heaters work in terms of what it might do to airflow and the virus. And I think it's just part of a whole plan that you have to have of operating in an era when there is an infectious disease spreading. And this isn't something that I don't think is going to be insurmountable for many schools, but it's important that they start planning now when they have the time.
At a hearing today, Dr. Rick Bright, an ousted vaccine official, said that even if a vaccine is ready in 12 to 18 months, which he called aggressive, that it might not be available for everyone right away. Listen to this.
If you can imagine this scenario this fall or winter, maybe even early next spring when vaccine becomes available, there's no one company that can produce enough for our country or for the world. It's going to be limited supplies. We need to have a strategy and plan in place now to make sure that we can not only fill that vaccine, make it, distribute it, but administer it in a fair and equitable plan.
Is there anything the government can do now to make sure that we are ready to manufacture a vaccine on a large scale?
This is probably the biggest problem we face with the vaccine, being able to make enough vaccine to vaccinate the country or even the world. And what you're seeing now is a program called Operation Warp Speed, where the government is starting to plan to actually manufacture the vaccine before we actually have the efficacy trial data, meaning start making it before we know whether it works. That's one way that we can shorten things, and it's a gamble and it's daunting, but I do think that it's in the realm of possibility, but we forget the fact that vaccines are not something that are made in months. These are some things that are made in years, and we have to be prepared to face this virus without a vaccine for maybe up to 2 years or so. And we hope for the best, but it's often a very big challenge to get a vaccine ready to a novel virus for which we have no human precedent.
I have to imagine that there's going to be quite a demand for the flu shot this fall. Are there concerns that perhaps there won't be enough of the flu shot to go around, or that all of that production could then have an effect on production and distribution of a vaccine?
We want to make sure that we do get people vaccinated for flu, especially as we're dealing with successive waves of this virus, because they're going to be competing for the same resources. Both flu and coronavirus are going to cause people to be hospitalized. They're both requiring personal protective equipment. They both require ICU beds and mechanical ventilators. So we want to keep as many people out of the hospital as possible from influenza by having them vaccinated, so we have room to take care of the coronavirus patients. We do have a pretty robust flu vaccine manufacturing capacity. It's very rare when we have shortages. Sometimes we do have shortages, but I do think it is something that we have to think about, because we do expect to have a higher demand for flu vaccines this season. But it's probably going to be different plants that will make the coronavirus vaccine than the flu vaccine.
The World Health Organization is predicting that this pandemic could be with us in some form for 5 years. What does our world look like over the next few years if we are still living with the coronavirus?
What we will see is more death tolls from respiratory viruses than we've seen in past decades, because the coronavirus will still be out there spreading, infecting people and killing some. We will see a lot of people voluntarily social distancing as the world kind of moves to a paradigm where you're dealing with the coronavirus as an everyday threat. So there will be some individuals, especially those in vulnerable populations, that will continue to social distance and continue to really try and limit their social interaction. We'll see people doing more telecommuting, maybe less traveling by airplane. More things are going to be done online. So I do think people will adjust to this, and it will change the way we approach life when we live in the midst of a coronavirus pandemic.
All right, Dr. ADALJA, great to have you with us again. Thank you so much for being back on.
Thanks for having me.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.